And this spring, the Hospital of Central Connecticut started offering advanced cardiac ablation procedures. It's a major step in treating heart rhythm disorders. And we're joined today by Dr. Moulin Chokshi, a cardiac electrophysiologist with the Heart and Vascular Institute at the Hospital of Central Connecticut, to explain what it means for patients at home and their families. Thank you for being with us, doctor. Can you explain what cardiac ablation is and how it can help people who might have an abnormal heart rhythm?
Definitely, and thanks for having me. So a cardiac ablation is a procedure where we place small tubes or catheters into the heart and actually identify exactly where a fast heart rhythm, like SVT or atrial fibrillation, may be coming from. We're able to identify where it's coming from the heart and actually apply energy to that part of the heart so it can't create that type of fast heart rhythm again. For patients who are having these conditions, oftentimes they can feel symptoms like shortness of breath or chest pain, and this can make a huge benefit from a quality of life standpoint.
So this new ablation program launched this spring at the Hospital of Central Connecticut. So why do you think it's a valuable option for patients and their families?
It's been a great benefit for sure for our patients and families in the area. We've been able to deliver high quality, cutting edge procedures closer to home for these patients. And so we've really had a great feedback from the patients that we've had procedures with so far in terms of their experience at Hospital of Central Connecticut, and we're looking to grow.
So who typically needs ablation?
So an ablation is typically needed by someone who has either a condition of SVT or atrial fibrillation, a fast heart rhythm. These are patients who may have symptoms like shortness of breath or chest pain. And oftentimes these patients can be actually fairly healthy otherwise. They may not have other cardiac conditions or other health problems. And so this procedure allows them to get back to that, active lifestyle that they were having before the heart rhythm happened. Really makes a big difference.
So are there certain warning signs or conditions like AFib that people should be aware of? And I'm also curious, is there a difference in symptoms for men and women?
A good question. So, for most patients, the symptoms or the warning signs that they could be developing one of these conditions is shortness of breath or chest pain or lightheadedness or dizziness. Patients may notice their heart rate's fast, kind of in situations they wouldn't expect it when they're just seated doing nothing. Patients can feel very differently, and so every patient feels a very different experience when their heart rhythm is fast. And these are all warning signs that patients should seek out medical care to get a diagnosis to see if they do have a condition like SVT or atrial fibrillation. And patients of all different ages can have these conditions, patients who are in their 20s up to their 80s, and so it can really happen at any age.
If you do need to get this done, is it minimally invasive? How soon can you get back to a normal routine?
It's a great question. So this procedure is done all minimally invasively. We actually use the veins in the legs to get these small catheters up into the heart. And so it's done with minimally invasive technology. The incisions are really microscopic. And patients are actually, after a few hours of bed rest, up and walking, climbing stairs again. Patients usually go home the same day, so it's a fairly quick recovery. And they're really able to get back to their active lifestyles fairly quickly afterwards. So it makes a huge difference for a lot of our patients.
Absolutely, yeah, especially if you get to go home the same day. Doctor, thank you so much, and we appreciate you being here. Dr. Moulin Chokshi is with the Hospital of Central Connecticut Heart and Vascular Institute. You can find more information by going to www.hartfordhealthcare.org/heart.